Hi and welcome everyone. My name is Dominique and this is my podcast. Hugs, handshakes, habibi. In this podcast I will speak about my life in the Middle East. I will tell you some fun stories I experienced here, and also I want to give you some hints what you need to see if you visit this amazing region. I hope that you enjoy listening as much as I enjoyed the recording, and yalla, let's start! Hi and welcome everyone, it's Sunday again, so time for a new episode of Hugs, Handshakes, Habibi. Today's episode I titled Prescriptions and Perspective, Navigating Healthcare in Dubai. And maybe you recognized last week I skipped the episode. That was because I'm not pre-recording 4 or 5 sessions and just upload them and schedule them. Usually I record the session on the Saturday or even on the Sunday morning here in Dubai and then upload them around lunchtime on the Sunday for the Central Europe time zone. Therefore, this gives me the opportunity to show you what's currently going on, but it has also the downside if I'm not able to record it on the Sunday. I have nothing in the backhand to provide you the episode. And this time I felt sick on the Saturday evening and therefore I wasn't able to record it. But I was thinking this week, maybe it's a good idea to speak about the healthcare system in the Middle East because it's differentiating a little bit from the system I know, at least from European. But again, I'm German, so I compared towards the German system. I know that the British system or the Spanish system is slightly different from that. So I explain how it works here in Dubai and you can compare it to your own system. First of all, also a short disclaimer. So I'm no attorney, I'm no doctor, and I'm no insurance professional. So what I explain is just my experience here, and this can be influenced by the healthcare provider my company gave me or the doctor's office I visit. So maybe experience of other people's are slightly different. But again, I try to bring you here my personal view, my personal opinion, and my personal experience. Let's speak about the healthcare system in Dubai in general. So first of all, we have the DHA, the Dubai Health Authority, and they are the authority for everything that is related to health, and they take care, they control and check the hospitals. They are also in charge for food safety and everything around that. So this is the DHA, and they are also managing the public healthcare system, which has several government-operated hospitals and clinics. And there are also private healthcare facilities that are available here. So mostly they are based in malls or in the communities. So as I explained earlier, we live here in communities, and in those communities there are either community clinics or community health center where a couple of doctors provide different services, starting with a general practitioner through dentist, gynecologist, psychologist, whatever you can imagine. Then Dubai has implemented a mandatory health insurance system for all residents that covers the basic healthcare needs, and employers are responsible for providing the health insurance for their employees. The level can vary. So I learned, for example, my healthcare provider, my health insurance provided by my company allows me to get glasses once a year for free. So once a year I go to the doctor, get a prescription, go to the mall, choose nice pair of glasses, and I get them ready and they are paid by the insurance. I think I have 20% is on me, but nevertheless it's a good thing. But this is not mandatory. This is a treatment my company gives me through an insurance contract. According to the international standards, what I saw in my life till now, the facilities here are top state of the art. They are top class. And a couple of people come here to Dubai also from other countries just for medical treatment. I know that a couple of Indian guys come over here. I know that also some European guys coming over here just for that. Then we have the general doctors, general practitioners, and we have a couple of specialized medical centers and hospitals. So for oncology, there is a big variety of treatment centers here. It's amazing what they do in effort to cure cancer and to relieve patients that are suffering from cancer. And this is the modern technology I'm aware of. I saw here. Then there is a big field of cardiology. So there are pretty good capacities here and pretty good doctors that are coming from all over the world to work here. And when I go to the office, I cross always a hospital that is a neurospine hospital. As far as I'm aware, they do that microsurgery on the spine for back issues, and do that with really fine-grained physical impact on the body. So this is a big thing. Also something I tested now first time is telemedicine services. So I get connected to a doctor. It's through the app of my healthcare provider. I click on a button. I have a doctor on a video call. The doctor is asking me stuff. I was able to show him the data from my smartwatch. So with that data, he did his first diagnostic. So it's not replacing a physical examination, but at least when I was suffering on Sunday and I really felt bad, so I wasn't able to take a cab to the next clinic or something. And before someone is coming out, they do this kind of diagnostics, which is pretty efficient. It's not replacing the physical exam, but you speak to someone who is a professional. He can take the first actions. So he gave me some ideas of medication I can get without prescription in the pharmacy. I ordered the stuff through one of the delivery apps. So 30 minutes later, I had a guy here with a motorbike delivering my medication, and I feel relief in that certain moment. I felt relief when I speak to the doctor, to the professional. He asked me about heart rate, about where is the pain, is it stomach, is it a bit upper, is it for longer, and all of that. And well, that was really convenient, to be honest, and I never had this in Europe, and that helped me. So in the worst case, if what he told me at the beginning of the session as well, if I can't figure out for sure that it's not life-threatening or whatever, then you need to go to the clinics and you need to run physical examination. But well, he had a good clue on what's going on, and he was very helpful there. And so there are also several health and wellness initiatives for proactive stuff. So we have a lot of public events here. So I think in December, there was a Dubai 30, I think it was 30 days of, I'm not into sports. You may figure this out now. I'm not into sports, but there were 30 days in different malls and on public places. You were able to get a yoga class. You had some back training to relieve your back from sitting all the day in the office. And there was a run. So we have a couple of marathon and half marathons here in the city during the winter time. We have a big cycling initiative. So they closed the road, and then the cyclists were on the road. And this is all part of this proactive promoting of health and wellness. And I think this is also important. As we spoke about the employer's responsibilities, so again, they have to provide me with the health insurance and everything. but this is on different levels. I know that there are also bigger companies here, so we are pretty small in this region, but I know there are bigger companies here in the region, and they offer something like a company doctor, where you can go to the doctor that is with the company and do the examination there. So that gives you relief from going to a clinic and waiting there, especially if you had something on work, you have a paper cut in the finger or something dropped on your feet or something, and you get it there. But this is mostly applicable for the bigger companies. I'm not sure if it's mandatory, but I heard that now a couple of times that this is necessary. So when I go to the doctor, it's usually I go there, I present my Emirates ID, they read the Emirates ID, and connected to the Emirates ID, there is my healthcare plan with the healthcare provider. And after reading the ID, they know what's in my contract, what's not in my contract, so they can give me a pretty good estimate if this is covered or not. So everything that is general is covered. So from that point, there is no worry about that. I was with the dentist. Maybe I do another episode about the dentist, because that was an amazing experience. I have a real fear for dentists, and I try to avoid them as much as I can. But I put that in the next episode, because we're already with 11 minutes. So making another episode about how the treatment is working. But yeah, they tell you everything. So most of the clinics, if there is a partnership agreement, you don't have to pay in the clinic or at the doctor's office. You just get the appointment. You see the doctor. At the end, you sign that you saw him, what he did, and they do the clearance between the companies. Yeah, so I think really I do a second episode because I want to share my experience with the dentist. I want to share the experience when I needed a doctor coming to my home, because I was sick last year and that was even more horrible. And the teledoctor said, oh, that's nothing I want to do through a video call. And I got a doctor deployed here on premise. So I put that in the next episode. Because I think when we speak about moving to another region and going someone abroad is being sure that someone's taking care about your health. Therefore, I really want to spend a second episode on that. And with that, I think we conclude this session. I have in mind we also speak about education system, and I will do the interview with someone who visited the country out of the perspective of a tourist. I didn't forget that. There's a lot of stuff coming up. And till then, well, enjoy the weekend, stay safe, and here next time.